Hello, I'm Dr. Emily Carter, a medical doctor focused on providing thoughtful, evidence based care and supporting patients in achieving better health outcomes. If you've got mucus or phlegm stuck in your throat that won't clear no matter what you do, there's a real reason for it, and I'm going to show you how to get rid of it. Before I say another word, do one thing for me: swallow. Just swallow your own spit right now and notice whether it catches, whether it feels like there's something back there in the way. Hold on to whatever you just felt because in a few minutes, it's going to help you figure out exactly which of these you've got. Now, you've almost certainly been to a doctor about this already and walked out being told it's your allergies or a touch of postnasal drip. Take this pill, try this spray, but you're here, which tells me it didn't really work. And I'll be straight with you. After 15 years of this, that allergy answer is right maybe a third of the time. Everybody else has been treating the wrong thing for months, sometimes years. I had a woman last year who'd been on allergy medication for 4 years for a throat that was never once about her allergies. So, we're going to find what's actually behind yours, and you'll spot it as we go. Two things in particular are going to surprise you. One is a cause almost nobody checks, not even most doctors, and it's the one I find more than any other. The other is something you're doing every single day, maybe right this second, that keeps the whole thing going no matter what's causing it. And a lot of you have two of these stacked together, which is the real reason nothing's worked so far. Let's find yours. And listen quick, while it's on my mind, I want you around a long time, strong, sharp, still doing the things you love well into your 80s. So, I took everything I tell my own patients about living longer and healthier after 60 and put it into one simple plan. It's already changed a lot of lives and it can change yours. The link is right there on your screen. Okay, back to your throat because what's actually causing this is probably not what you've been told. If part of you has quietly worried this might be something serious, take a breath. The large majority of the time, this is one of a few very ordinary, very fixable things, and you'll likely have your answer and your fix before this video is done. Let's take them in order. Let's start with the one you've heard, because for some of you, it's the right one, and I'm not going to pretend otherwise. Postnasal drip. Simple version. Your sinuses make mucus the same as everybody's, and instead of it running out the front the way it does with a cold, it runs down the back of your throat, pulls back there, drives you up the wall. That's a real thing, and it does cause exactly this, and it's worse at night once you're lying down, because there's no gravity to carry it away anymore. So it just collects at the back of your throat while you sleep, and you wake up having to hawk it all up. A lot of you have had this ever since a cold years ago that never fully cleared. Others have what we call non-allergic rhinitis, which is just a drippy, touchy nose that reacts to cold air, strong smells, a change in the weather, with no real allergy behind it at all. Same drip, same mucus, same result. So, how do you know if it's you? It usually comes with the nose. If your nose is stuffy or runny along with the throat stuff, if it gets worse in spring or fall, if you've always been an allergy person, then yes, this is probably part of your picture. And the fix is genuinely simple. A saline rinse once a day, a little neti pot or a squeeze bottle from any drugstore. Couple of dollars. Use distilled water or water you've boiled and cooled, not straight from the tap. It flushes the drip right at the source. And for some of you, that one habit is the whole answer. But here's why I'm not going to camp out on this one. Most of you have already been down this road. You've done the allergy pills, maybe the spray, and if that had been the whole answer, your throat would be fine by now, and you wouldn't be here. So let's get to the one that actually gets missed. Okay, this is the big one. In 15 years, it's probably the single most common thing I find in people with this exact complaint. And it's almost never what they came in thinking. It's reflux. And I can already feel half of you pulling back going, no, that's not me, I don't get heartburn. And that right there is the exact reason this one slips past everybody. Because there's a type of reflux that doesn't burn, not even a little. You can have it every single day causing all of this and never feel a thing in your chest. Here's what's going on in plain English. There's a valve at the top of your stomach that's supposed to stay shut. As we get older, it gets a bit lazy, a bit loose. So, small amounts of what's in your stomach slip back up. Not enough to give you that classic burn, and they travel up and reach the back of your throat in your voice box. Now, your stomach's lined to handle that stuff all day long. Your throat has no such lining, so it gets irritated. And an irritated throat does what an irritated throat always does. It makes mucus to coat itself and protect itself. And there it is. There's the phlegm you keep trying to clear, and it gets a little sneakier than that. Along with the acid, there's an enzyme that comes up called pepsin. That's just the thing your stomach uses to break down protein in your food. The problem is pepsin actually settles into your throat tissue and it stays there. So later on, when you have a coffee or some tomato sauce or a glass of wine, that bit of acid wakes the pepsin back up and it starts chewing on your throat all over again. Which is why this thing seems to have a mind of its own, flaring up for no reason you can point to. The medical name is LPR, loring-pharyngeal reflux, if you want the whole mouthful. Most people just call it silent reflux, and that's a good name for it because the silence is the entire problem. No heartburn, so you and your doctor go looking everywhere except the one place it's actually coming from. And honestly, I don't entirely blame the doctors for missing it. A regular visit is 10, maybe 12 minutes. You come in saying you've got mucus and a cough, they hear allergies or a lingering cold, hand you something, and you're both back out the door. Nobody has the time to sit and walk through what your throat is doing at 2 in the morning. Finding the answer is the easy part. It just takes somebody slowing down long enough to look. And a 10-minute visit doesn't leave room for that. That right there is the whole reason I sit down and make these. I think about a patient I had, older fellow, retired, and he used to half me crazy because every few months he was convinced it was something new. One visit, he was sure it was throat cancer. He'd read something online and worked himself up over it, and after all the worry, you know what it turned out to be? The man was eating a big bowl of cereal with milk, standing at the kitchen counter at 11 o'clock at night, then going and falling asleep in his recliner, tipped halfway back. That was it. That was the whole thing. We fixed how he ate at night, and the throat settled right down. He still thought I was some kind of genius for it. All I'd really done was know where to look. So here's how you figure out if this is you, and I want you to be honest with yourself as I go. It's usually worse in the morning. You wake up with it and have to clear and clear to get going. Your voice might be a little rough or growly early, and then loosen up as the day goes on. That feeling like there's a lump or a marble stuck back there. Or you can swallow food just fine, but swallowing your own spit feels like there's something in the way. That's one of the most telling signs there is. And it tends to get worse after you eat or after you lie down. If 2 or 3 of those just made you go, huh, that's me, then I'd put good money on this being your answer. And there are a few more giveaways. The little things people never think to bring up. You clear your throat before you start talking every single time. Almost like a warm-up on the phone especially. You get a sour or bitter taste some mornings, or your breath isn't fresh no matter how well you brush. Maybe there's a dry, tickly cough that brings nothing up and gets worse the moment your head hits the pillow. Some of you notice it flares after the exact same things every time. A big late dinner, chocolate, peppermint, anything fried, that second cup of coffee. And some of you find it acts up most when you've been using your voice a lot. A long call with your daughter, singing in church, an afternoon catching up with friends, and by the end your voice is tired and you're clearing it every other sentence. Then here's the one that really throws people. A lot of folks with silent reflux feel like they've got too much mucus and a dry, raw throat at the very same time, both at once, because the irritation is cranking out mucus while the acid is drying and inflaming the surface. And that lump feeling where it seems like something's stuck, even though your food goes down fine. That scares people more than all the rest of it put together. They're certain there's a growth back there. The large majority of the time there isn't. It's the irritation plus a little muscle tension right at the top of the throat, and it comes and goes as the reflux does. Worth getting looked at once just to set your own mind at ease. But for most of you, it is not the thing you've been lying awake afraid of. And one thing I want to say to you straight, if you've started to wonder whether you're imagining this or somebody's hinted it's just nerves or you being a bit of a worrier, you are not making it up. This is a real physical, well understood thing happening in your throat. I see it constantly. You're not crazy and you're not a hypochondriac. You've just had something that nobody took the time to explain to you properly. So here's exactly what you do about it. And this is the real lever more than any pill. Stop eating in the 3 hours before you lie down. That's the big one. Keep that last meal smaller. Prop the head of your bed up a few inches on something solid. Real blocks under the legs or a wedge under the mattress so you're not lying flat while it tries to creep up. And go easy on the late coffee and the late wine because that's what keeps the pepsin fired up. Do that and a lot of you will feel at ease within a week. A few more that help if you want to go further with it. Don't flop onto the couch right after lunch either. That's the same mistake as bedtime just in the middle of the day. Loosen your belt and skip the really tight waistbands because anything pressing on your belly nudges that valve open. And here's an easy one. A stick of sugar-free gum after a meal gets you swallowing. And all that swallowing washes the acid back down and waters down whatever's left sitting up top. Small thing. Surprisingly useful. One thing I don't want you doing is shrugging this off for years as harmless because that acid and that pepsin working at your throat day after day can slowly change the tissue back there. It's usually slow and very manageable when somebody's keeping an eye on it, but it's worth handling, not ignoring for a decade and quick because it matters. Some of you are nodding at the reflux right now, and you've also got that stuffy allergy nose from a minute ago. That's two of them stacked. And it's the exact reason a single fix never worked for you. You handle both. Let me stop for 1 second. If this is the first time any of this has actually made sense for your throat, do me a small favor and hit subscribe and tell me down in the comments how long you've been putting up with it. I do read them and it honestly tells me what to make next. And if your husband or your sister or somebody you sit with on Sunday does this all day, send it over to them, would you? All right. This is the one I told you that you're doing to yourself. It sounds almost too simple, but I watch it trip people up every single day. The clearing itself, the very thing you do to get a second of relief, is a big part of why it never stops. When you do that hard ahem, that really forceful one, you're snapping your vocal cords together with a fair bit of force, and that tissue does not enjoy it. It gets a little swollen, a little raw. And irritated tissue makes more mucus. So you clear, which irritates, which makes mucus, which makes you feel like you've got to clear again. People go around this loop hundreds of times a day, completely unaware they're feeding the very thing they're trying to get rid of, and it turns into a habit sitting on top of a reflex. Half the time, you're not even clearing real mucus anymore. You're doing it because your throat feels a bit off, and your body has learned that little throat clear as the answer. Watch yourself for one afternoon and you'll catch it. You do it walking into a room right before you pick up the phone in any quiet moment. That's wear and tear your throat is taking all day long for nothing. I've had patients cut this in half just by catching themselves and stopping. So when you feel that urge come on, don't bear down on it. Take a sip of water instead or do a quiet, firm swallow. No sound at all. I know it sounds like nothing. It's one of the most useful things in this whole video. 2 more. And I almost left these out, but I've watched both of them fool too many sharp people to skip them. Go look at your pill bottles. If you take a blood pressure medication that ends in pill, and a lot of you do, lisinopril, ramipril, that family, those are known for causing a dry, nagging cough and a tickle in the throat. About 1 in 10 people on them get it. And the sneaky part is it can show up months, sometimes a year after you started the pill. So it never occurs to anybody to connect the two. Now, I am not telling you to stop your blood pressure medicine. Please don't do that on your own. I'm telling you to bring the bottle to your doctor and ask flat out, could this be it? Because there's almost always another option that works just as well, and the cough just quietly goes away. I've watched that happen more times than I can count. I had a fellow on lisinopril a good 2 years, coughing the entire time. He'd been to an allergist, had the chest x-ray, the whole workup, spent real money chasing it. We swapped that one pill, and inside about 3 weeks, the cough was simply gone. He was almost annoyed about it. All that time and worry over a side effect nobody had flagged for him. And here's one more that catches careful people especially. A lot of you, when this first started, did the sensible thing and reached for an over-the-counter antihistamine, a Benadryl, an allergy tablet, figuring it's allergies. This will dry it up. That's the trap. Those older antihistamines do dry you out, but they dry out everything, including the mucus that's already stuck back there, so it goes from runny to thick and gluey, and harder to shift than before. Same story with the decongestant nose sprays. Use one for more than 3 days or so, and the nose rebounds worse than when you started. So if your throat actually got worse after you began treating it yourself, that is very likely the reason why. And the milk question fast, because somebody always asks me this one. Milk does not make your body produce more mucus. It just briefly coats your throat and makes whatever's already there feel a bit thicker for a few minutes. So if skipping the evening glass makes you more comfortable, by all means, but it isn't your cause. And I don't want you thinking you've cracked it by giving up cheese. If your mornings are the worst part of this, here's why. As we get older, we dry out less saliva, and we drink less because the thirst signal fades. You just don't feel it like you did at 40. So the mucus turns thick and sticky instead of thin and slippery, and thick mucus grabs and sits where thin mucus would have slid right down. Then you spend the night flat on your back with the furnace or the AC pulling every bit of moisture out of the air, and any silent reflux creeping up with nothing to wash it down. It all piles up by morning and you wake up into it. And if you sleep with your mouth open, which more of us do as we get older, especially with a stuffy nose, you're running dry air straight over the back of your throat for hours. That's the sandpaper feeling some of you wake up with before you've even had a sip of water. If your partner's mentioned you've started snoring or sleeping with your mouth hanging open, that's part of your picture too. The fix is boring and it works. Run a humidifier in the bedroom at night and clean it weekly so it isn't blowing gunk back at you. And drink through the whole day warm things, especially tea or broth or warm water, which loosens thick mucus better than anything at the pharmacy. That one glass of water at 3 a.m. can't undo 8 hours of drying out on its own. So it's the all-day habit and the room air that actually change things. And if a stuffy nose is what's making you breathe through your mouth all night, that saline rinse before bed earns its keep here too, because it lets you keep your mouth shut and breathe through your nose, which keeps the whole airway moist. One more set of things worth naming plainly because they pour gasoline on every cause we've talked about. Smoking, of course, even the odd one, and vaping is no kinder to your throat. Alcohol in the evening, which loosens that stomach valve and dries you out at the same time. The heavy throat clearing we already covered, and dry air, winter heat, especially. You don't have to be a saint about any of it, but if 2 or 3 of those are part of most days, easing back on them will move this more than you'd guess. Quick, but important. Doctor hat all the way on for a second, because most of the time this is just a nuisance and once in a while it isn't. If you're ever coughing up blood, even a streak, go get seen. If you're bringing up green or rusty stuff with a fever, that can be a chest infection, and it needs a doctor, not a humidifier. If your voice has been for more than 3 weeks and it isn't budging, or you're losing weight you didn't set out to lose, or food is starting to catch when you swallow, those are not the everyday throat thing we've been talking about, and I don't want you sitting at home doing saltwater rinses for them. Get those looked at. Everybody else, let me put the whole plan in one place fast. Drink through the day. Warm things especially. And if your urine's darker than pale straw, you're behind, catch up. If it's the nose, the postnasal drip, a saline rinse once a day, distilled or boiled water. If it's reflux, and for a lot of you it is, nothing to eat in the 3 hours before bed, smaller last meal, raise the head of the bed and ease off the late coffee and wine. Catch yourself clearing your throat and stop. Sip or swallow instead. That's the one almost everybody skips, and it's one of the most powerful. Humidifier in the bedroom at night and check your pill bottles for a PRIL. Then take that to your doctor. Do the ones that fit you. Give it 2 weeks, though most people notice something in the first few days. One last thing before you go. Remember that pepsin I told you about? The stomach enzyme that parks in your throat and flares up every time you eat something acidic? Here's what gets people. Some of the foods setting it off are ones you think are good for you, things you're probably eating at breakfast right now, feeling pretty virtuous about it, that are quietly keeping your throat raw all day. There's one in particular, something a lot of you have almost every single morning that I watch wreck people's throats while they're dead. Sure, it's good for them. So that's what I'm going to walk you through next. The everyday foods that feed silent reflux, which ones to back off of, and a few that actually calm an irritated throat down. If the reflux part hit home for you, that's the one to watch. And it's right there on your screen. I'm Dr. Emily Carters. Look after yourself, and I'll see you in